I'm Rommie Duckworth for EMS World. Sometimes when educators are dealing with difficult students, it can be very, very frustrating for everyone in the classroom, the student, the educator, the EMS coordinator. As EMS educators, we are the medium through which the message of EMS education goes through. As a result, everything that we do shapes the message, whether we're teaching about chest pain or shortness of breath. Even if we're using a pre-scripted curriculum, everything that goes through us as educators gets shaped by the way that we present and the way that we feel about the material. The most important thing that you can do to connect with your students is to first take a look at the material and connect with the material. Think about not only what do you know about this material, not only what do you know about this subject, but think about how you feel passionate about it. Why is it that you want to teach it? Even if it's something that's given to you on a plate and you're told to teach it, you need to be able to think, why do I care about this? We always want to know why the students care about it, and we need to connect with them. But if you take the step as an educator to connect with the material yourself first, as that material goes through you, as you teach that material, your passion and your enthusiasm will connect with the students and connect them with the material that you're teaching. As an educator, when you're dealing with a particularly difficult student, it's very important to remember that there are no such things as truly difficult students, only difficult behaviors. There are a number of steps that you can go through to identify the difficult behavior and eliminate it, or at least manage it. I like to go back to the initial key components of adult education, recognizing that adults need to be self-directed, they want control over the program in some way. They need to be respected. You need to treat them not like children, but like fellow adults and peers. You need to remember that adults are coming into your classroom with previous education and experience. And what your job as an educator of adults is to do is to connect the new material that you're teaching with the education and the knowledge that they already have. Connect what's coming in with what they already have in their minds. As you go through all of the steps of evaluating what's the difficult behavior of the student, you may also need to look at cultural problems, cultural barriers that a student may have. English as a second language might be a difficulty in getting the education across to them. It may be that you're teaching to somebody, you may be teaching to one particular age level, teaching to a baby boomer, or teaching to a millennial, and you've got students of another age in your classroom. You need to make sure that your teaching is age appropriate. You also need to recognize that the students are going to come into your classroom as adults with different education levels. Is what you're teaching at a level that's appropriate for the students that you have in the classroom? Most importantly, you want to think, what can I do to make this material relevant to students? All adult students want to know how they're going to be able to use the material that you're teaching. Make sure that even if you're teaching things that are a little bit more academic, if you're discussing pathophysiology and you're going through the whole wide variety of anatomy and physiology, make sure that you're going in there and you're also letting them know how this relates to hands-on care for the patient, how they can do some good in their community, how this is going to make their lives easier and their jobs better. I'm Rommie Duckworth for EMS World. Thanks for watching.